3.
Hi, Dr. Deborah Ekstrom from Orange County Plastic Surgery in Newport Beach, California, and Salisbury Plastic Surgery in Worcester, Massachusetts. I want to talk to you a little bit today about the difference between a silicone implant and a saline implant. And I think it's very important to know that a saline-filled implant is a good implant. Think of it more as kind of the workhorse or a starter sort of implant for some people, whereas a silicone gel implant is a little bit more of a premium product. And now it's true that I do put in mostly silicone gel implants, and I want to show you what they look like. This is a tiny silicone gel implant. It sits on the ribs like this. When you sit up, it turns into more of a pear, like you split a pear in half. It looks more like that when you hold it up. It doesn't have all those ripples and wrinkles because you've got your tissues against it. But this is silicone gel, and if you close your eyes and put it in your hand, it would feel very much like a breast. This is a saline implant. It's got a bunch of air in it, which isn't true when it's in the body, but we have this valve here that something plugs into, and we fill it up with the saline. I just want to show you the saline in between. There won't be air in it. It would be filled up completely, but you can see it's got a shell, and that shell is made out of a silicone rubber. This is just part of the implant, and then this is the valve on the back. And this little bad boy right here sometimes gives us trouble down the road where it starts to slowly leak, and that's when patients see a slow deflation of their implant. Whereas with a silicone gel implant, there's nothing to deflate. We don't fill it in the operating room. It's all pre-filled. And when you hear people talk about ruptures, they're talking about a silicone gel implant. Now, I'll tell you, these don't rupture very easily, especially these new ones that we have. They'll tolerate a lot of abuse. I've seen them thrown down the stairs, thrown against a fire hydrant. We have a little TikTok at Salisbury Plastic Surgery about that, and driven over it with a car, poked it with the scissors, all kinds of things. So you can play football, you can skydive, you can do the things you want to do with either one of these implants. Very, very resilient. I put the saline implants into patients a little bit more that may be younger, that are planning down the road they're going to change into a silicone implant anyway. They are a little less expensive, so for someone who's on a tight budget, it could be a really great solution. It's not a great solution for someone who's really thin, who ripples and wrinkles might show through the skin, in which case a silicone implant's a better choice, or somebody who doesn't want to have to change that implant out in less than a decade. Now, some of them do last 3 decades, but it's pretty uncommon. So by 7 years, 1 in 10 has already deflated, either through that valve failing and a slow leak, or through getting a little tiny pinhole from folds and wrinkles, just like your skin folds and wrinkles. It folds and wrinkles, and at the end of one fold, it may get a little pinhole. And I like to say that it's sort of like a jelly jar. If you take a grape jelly jar, plastic jelly jar that you squeeze to get the jelly out, if you put a little pinhole in that and the jelly was in there, that would be like a silicone gel implant. And you put it in the sink in the morning, it would look just the same. But if you had an empty jar like that, filled it up with water, put a little pinhole in it, at the bottom, by morning, the water would have dripped out. So that's the difference between silicone and saline. Now, if saline does drip out of the implant, it gets absorbed. It's the same fluid that runs in your veins and blood vessels and in your tissue fluid, and it is not dangerous. And things don't get into the implant typically. It's such that it makes it toxic or something like that. That's a false idea. Silicone gel, on the other hand, does not get absorbed. At the same time, the CDC has said that silicone gel is the most inert substance that they've seen. And just remember that the silicone gel is fused to the inside of this, like Jell-O sticks to a bowl. So even if it got a rip, you'd squeeze it, it would bulge out, and then when you stop squeezing, it would go back in. So it is possible for it to get out, but it's not very easy for it to happen, and it's really hard for it to get ripped. The other thing to know is that your body makes a membrane around this implant when it gets inserted in the body. So by 6 weeks, it's got a membrane around it, typically called a capsule. And if you get a rip in your implant and some silicone gel got out, typically it would stay inside that capsule, and it's really not of any concern. We do no longer see the little droplets going through here. We don't see them coming through anymore. They don't get in your lymph nodes from coming through or cause trouble. Not that they caused really trouble before, but they could be seen there, so we prefer not to see that. So when we do the sizing, we have this very interesting sort of sizer that we lay on top of your breast inside your shirt, put you in a bra, and you can figure out what you're going to look like afterwards, and see when you stand up, this sizer is going to that your implant will look like the sizer looks, and that helps you to decide what size implant you want should you decide to go through a sizing process. So that's a little bit of information about silicone and saline implants and how we go about choosing and the pros and cons, just to give you a little taste of what breast implantation and breast augmentation is about.